I think the truth is the government is the victim of its own muddled thinking here, because we were told that Monday was going to be Freedom Day. Well, we know that what's actually happened is that over the last 2 to 3 weeks, ministers have realised that simply moving from lockdown to total absence of control doesn't actually deal with the issue that confronts us. And what we need is a much, much more careful, nuanced approach. Now, I think it's absolutely right that the pingdemic, as it's been called, the pinging people who've been in contact for 15 minutes with other people who've been tested positive, that has had an effect that I think pretty much every one of your listeners and viewers will have known somebody who's been pinged. And I do think we need to be more discriminating about and very, very much clearer about what is the expectation, what are the risks, it's all very well the Prime Minister saying act responsibly, but the government's extremely unclear about what acting responsibly in fact means.
I mean, what are your thoughts on also sort of the warnings from SAGE? I mean, it's making the front pages today that, in 3 weeks we could be looking at another wave. What are your feelings about that? Are you concerned?
Well, yes, I am concerned because I don't think you need to look 3 weeks ahead to see another wave. I think it's upon us. I think what's less clear, and nobody can know this, SAGE can't know this, ministers can't know this, is exactly what the impact of that is going to be as the autumn develops on the National Health Service. The whole story of lockdown has been shaped by the need to ensure that the workload that presents at NHS hospitals doesn't get out of control. That's why we've had the succession of lockdowns we've had. And yet, if you talk to people who are in NHS accident emergency departments now, they'll tell you that here we are in the middle of July with levels of attendances at A&E departments that match the normal figures for January. Now, it's no good just saying, oh, well, we've broken the link between the virus and hospitalizations. Of course, that's much weaker because of vaccinations. And that's, of course, very good news. But what we don't know and need to be careful about is what the impact is going to be of returning to something closer to normal, which we all want to do, but doing it at a pace that doesn't go back to the beginning in terms of unmanageable workloads in hospitals.
Yeah, it's interesting, isn't it, Stephen, that people say that with the national lockdowns, which hopefully we won't see again, suddenly there's a kind of sudden stop to kind of the spread of the virus to a large degree, and that then eases and breeds its way into hospitalisations. Whereas this time round, what we might well see is just sustained pressure on the National Health Service for months and months to come, unless something does change. But do you think politically for Boris Johnson, it would be very, very, very difficult for him now to row back on things like face masks or nightclubs or further restrictions, given the fact that, they've only just been eased?
Well, yes, of course it would be difficult. But in truth, of course, the government is already rowing back very strongly. A month ago, we were being told that once the restrictions were lifted, there would be ministers would not contemplate going back to restrictions. Now they're explicitly saying that that's one of the options that will have to be considered if things don't go well during the autumn, and that you don't need to have studied the newspapers with any very carefully to have seen that the tone of ministerial statements has changed dramatically over the last 3 weeks. So it goes back. We all know, it's a matter of fact, that we have to learn to live with COVID. That's the phrase that people use. Yes, we have to learn to live with COVID. But that doesn't mean pretending COVID doesn't exist. What we have to do is to learn, and we'll learn this progressively because nobody's done it before, what it is possible to do without imposing unmanageable burdens on the health service, and what it isn't possible to do. And I think it's also worth reminding ourselves that if we see continued rises in attendances at A&E departments that are COVID related, Of course, that's very bad news for those individuals, but it's also extremely bad news for the people whose operations are cancelled, have been delayed throughout the pandemic, and are then cancelled again because the health service can't deliver the service we need to see it delivering to those who are on growing waiting lists.
And let's just stay on that theme. We just want to get your thoughts on the NHS. Could be offered that 3% pay rise up from 1%, that initial proposal. Is that enough?
I think the answer is that there is no figure that anyone can quote that is going to be a fair reward for the unbelievable efforts and devotion and commitment we've had from NHS staff since the beginning of the pandemic. So there's no number that's a fair number. But at the end of the day, the government has to produce a decision, and the question is how that decision is reached. The thing that I struggle with, if I'm honest, is why the government continues to put out numbers rather than wait for the advice from the pay review body. We've had pay review bodies to advise on NHS pay in this country since the 1980s. And this year of all years, it seems to me the government would be well advised to listen to that advice before rushing out with its own number, and in a way that is almost bound to produce a negative reaction from NHS staff.
And Stephen, just very finally, while we've got you, can we just get your thoughts on our top story today? You know, former cabinet minister, you know how difficult and complex some of these issues can be. What's your thoughts on the number of migrants we now see crossing the English Channel? You know, the government don't seem to have an obvious, easy solution to this. Frankly, I mean, they are failing, whatever you think of the issue, to stem the number of refugees and migrants making that very perilous journey. What do you think needs to be done? What does Priti Patel need to do to get on top of this?
Well, the first thing to say is that you're, of course, 100% right to say that this is an immensely complex problem and there are no easy answers. It's something that the European Union has been grappling with as a whole since, for the best part of the last decade. And as a strong, I know your station won't agree with this, and particularly Nigel Farage won't agree with it. But the fact is that migrants coming to Europe from North Africa and the Middle East are a problem that Europe as a whole has to face. And imagining that we can draw a line in the English Channel and say it's now a French problem, I think is a, frankly, grotesquely unrealistic way of looking at it.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.